Welcome dear doctors to Kids Covering. Myself Dr. Parv, and we are beginning the immunology now, and the topic of discussion in this topic of immunology is severe combined immunodeficiency. So severe combined immunodeficiency. Now I think from your basic knowledge you must be aware that the normal patient is having immunity and the immune system is compromised. The immune system is comprised of T cells and B cells. Okay, the immune system is comprising of B cells and T cells, and if the T cells and B cells are patent, they can fight infections very easily. But what happens is, in severe combined immunodeficiency, there is a word which is coming, that is combined immunodeficiency, and combined means that you have got B cell, T cell, both of them are going to be deficient and the immune response is decreased. So the child or the person is not able to fight the infections. Got it? This is called a severe combined immunodeficiency. Now, the definition is, it's a severe combined immunodeficiency is actually a serious life-threatening issue. It's a life-threatening problem which is having congenital immunodeficiency, which is characterized by absence of T cells and abnormal or absent B cells. See, why I'm telling you that this is abnormal B cell, because if you remember from your basic knowledge only, that T cells are responsible for synthesis of helper T cells, and these helper T cells are going to stimulate the development of B cells. So if there is no T cell which is being formed, the helper T cells are not getting formed, there will be no good development of B cells, and there will be abnormal B cell function that is going to be there. Now, severe combined immunodeficiency disorder. Severe combined immunodeficiency disorder, it's a recessive thing. Okay, it's a recessive thing. So let me just write REC. Okay, this is how recessive. So C is there, S is there. So SCID, severe combined. So it's a recessive. So 50% of the population is X-linked recessive, 50% is going to be autosomal recessive. Got it? Now, clinical features, of course, you'll be having immune compromise, you will be having recurrent infections, laboratory findings will have decreased WBC counts, and see, if B cells is not functioning properly, G, A, M, E, all of them are going to be decreased. So how will you treat? You have to give antibiotics, you have to give immunoglobulins from outside, you have to do a bone marrow transplantation, isn't it? And what are the contraindications? Please don't give live attenuated vaccines. See, normally we give live attenuated vaccines to the patient so that there is antibody formation. Okay, but it comes with a risk of infection also, because the organism or the antigen is live. There's a risk of infection. Now, if you give in the patient of SCID, see, the risk of infection is too much. I should say that there will be a severe infection, and antibody formation is also not going to happen. So that's why it's useless to give the live attenuated vaccine in the patient suffering from SCID. So we never give. This diagram I've already taught you. So this was a small clip on SCID, severe combined immunodeficiency. Just for the MCQ purpose, it is important, and yes, sometimes some universities can ask you this immunodeficiency. So thank you so much for watching. We'll see you in the next class.